Hello, everybody. We're going to get to it here. AAA scan. So we're going to begin with our probe, and we're going to put the index marker to the patient's right. So index marker facing this. We'll start with the transverse position. Get our screen going here. We'll look at our presets. See what we have. Here's an abdominal aorta, gallbladder. Let's try the abdomen. Okay, so here we go. Want to increase our depth. All right, so what we see here, we're going to start right at the subxiphoid area. We're going to locate the liver, which is to the top, and the spine shadow, the vertebral process there is very hyperechoic, and we see the pulsatile aorta right there. We're starting up here subxiphoid, and we're going to identify the aorta in the proximal view. It will be pulsatile, as we see, and it's an anechoic circle in transverse view. Your abdominal aortic wall will be between your liver and your spine, and the IVC will be to the left, as we've talked about. So you can see the IVC to the left, the aorta is there. I'm compressing this. It is the IVC. I see the aorta. And our first stop along the way is to scan to find the celiac artery, the celiac trunk, which will split towards the spleen, to the splenic artery, then to the left as the hepatic artery. This is also known as the seagull sign. So what we're going to do here is attempt to find, this is at times can be a tough view initially, the first stop on our trolley line through the aorta. And we see a little bowel gas. To relieve bowel gas, to move bowel gas in the patient, you want to apply some probe pressure, maybe jiggle to encourage peristalsis, or try a different angle. And we have a pulsatile aorta. See just a hint of that, the hepatic artery. I'm trying to get a nice seagull sign here, but at times you can't. So we're right there at that first stop. And then as we will move on past, we'll go down. I see a hint of it, but can't seem to move the bowel. Right there, the bowel gas out of the way. We see a little bit of the trunk there. And we'll go down to the second stop. So as we scan down further, we'll keep the aorta between the liver and the spine shadow. We are looking for the superior mesenteric artery, the SMA. Above the aorta here is the SMA. So we can see a nice picture of our SMA right there, the superior mesenteric artery. Some call this the mantle clock sign because above that is your splenic vein, and you may see the left renal vein draining into the IVC. And above is the pancreas that surrounds from above. So you can see sort of the mantle clock sign right there. It's a good shot. Now, as we move down the aorta, the mid to the aorta, to our third stop here, we'll go more, you will hit the mid-aorta. Now, this area is the hardest to view for the abdominal aorta because we have the transverse colon along the top. So we must apply pressure and move the bowel gas shadowing. You can decrease your depth as this, what happens here, it becomes more superficial right around here. You must decrease your depth as now the aorta is much more superficial. It's about 5 centimeters. As we go more distal, it can become as the depth. If you look at the scale to the right of your screen of the shot there, about 2 centimeters. So we see now as we're getting further, we keep the liver between the aorta, between the vertebral process, the spine. It's a nice shot here. We can see the bowel moving off to the left. I'm going to make this a little bigger here. So what we do typically in aorta, we'll freeze the shot, and then we'll apply the caliper if we were measuring. So I'm going to do an example. And we move the first point is outer edge to outer edge, straight transverse. So here we have a nice really outer edge to outer edge, 1.6 centimeter. Let's drop it down. It's actually smaller than that. So when we do that, we know that the caliper measurement and the outer edge to outer edge, the normal diameter is less than 3 centimeters, and an emergency aneurysm case is 5.5 centimeters. So there's an example of your measurement. And we're going to go back to real time here, back to the aorta. And you can use your functions here. And as we go down, we're moving to ID. The aorta is now the most superficial here. We'll note the bifurcation of the left and right iliac arteries in real time as we move down. And we see the bifurcation happening here. We see the bifurcation of the aorta right there. Now we have the 2 iliac arteries. Just for grins, maybe we'll throw some color on there, see what we got. So we can see the 2, we see the spine, we see 1, we see the other. That's on high, actually. There's low, a little bit easier to see. I've got the Doppler off. And we see the bifurcation. Now we're going to identify the aorta. So we're going to twist. Maybe we'll start at the top and we're going to twist our probe. We start in the transverse and then we'll turn 90 degrees clockwise and we'll lay out that aorta by each side. You can see the aorta there in the longitudinal view. You see our markers. There's our celiac trunk and you can see our superior mesenteric artery. We'll move down the aorta. We see the shadowing from the bow. We see acoustic shadow there. The aorta is nice and pulsatile. You want to make sure you're differentiating that between the IVC as we move up. You can see that it's much more hyperechoic. There's the spine shadow from the bone. And let's try some accents. A lot of times it's kind of perpendicular. I don't know how much Doppler we're going to see here. There we go. So we got our color gain. And we're looking at our aorta. Helps differentiate it. Nice low flow state. Turn down the color gain. And remove the color. And there's our longitudinal process. I have the index marker pointing cephalic towards the patient's head. See the aorta. See our landmarks. Now, one more thing you can do when measuring the aorta, if you're worried about aneurysm, have the patient roll over in the left lateral decubitus position. And we'll take a look at the aortic root. So right here, parasternal long axis. Take a look. We'll change our preset, go to cardiac. And we'll get a nice shot here of the aortic root. Clean this up a bit. And there's our aortic root. We don't see any kind of dilatation around the root itself. You can angle out. You can just go that extra mile and take a look at the aortic root. And the parasternal long axis view. And that is how we do aortic abdominal aneurysm evaluation. Thank you very much, everybody. Okay, we have another patient here who has a much better image. As you know, patient to patient, different imaging. And right here, we're going to be able to scan the celiac artery. And we see the celiac trunk, which splits towards the spleen. Right here we can see we're working on the seagull sign. And we see the nice image here. The splenic artery, and then to the left to the hepatic artery. This is known as the seagull sign. And we can see it here as we scan and fan through it a lot more than our last patient. And there's the seagull sign. See it up to the right. And then we would go on down and continue our evaluation of the aortic. There's the superior mesenteric artery, spinal process, spine shadow, and there's our aorta.